Good morning, everyone, and good evening in Europe and India. Metabolic syndrome and management with Ayurveda is the topic for this session today. We are going to talk to Dr. Ish Sharma, who is an educator, practitioner, and a researcher of international repute. Dr. Ish has done clinical trials to prove efficacy of Ayurvedic herbs and medicines for metabolic syndrome. I am Amita from Nourishtalk, a global platform for natural and holistic therapies. I'd like to introduce all of you to Dr. Ish Sharma, who's joining us live from India right now. Welcome, Dr. Ish.
Thank you, Amita. Thank you, Nourishtalk.
Okay, we can get started with a simple definition of what exactly is metabolic syndrome.
Okay, maybe because the audience we have got would surely be aware with metabolic syndrome, or we also know it by the name syndrome X, because its origin was unknown. That is why the symbol X was used for unknown, because the modern medical science could not figure out, how come does one get all these four big diseases in one body at the same time. So there being no common cause, they named it as syndrome X, or then they figured out it to be a metabolic disorder, so they called it metabolic syndrome. And it is an consortium of, it is an association of hypertension, obesity, high blood pressure, and dyslipidemia. Your cholesterol levels would be wrong, you will be a diabetic, you will be overweight, and you will be having hypertension, 4 in 1. Then we label you as a patient of metabolic syndrome or syndrome X. There can be a fifth entity, that is high uric acid, or what we call gout. There it can also accompany gout, which is a severe joint pain. So 4 or 5 disorders at one time in one person is the definition for metabolic syndrome.
Okay. So you talked, what causes so many diseases all at one time? I mean, that's a very heavy disease set that you talked about earlier.
Yes. So surely, see, the metabolism can be deranged by so many things, stress, wrong eating habits, pollution, and diabetes is believed to be the parent entity in this group. It is believed that diabetes or insulin resistance is the most important factor. So insulin is the leading cause. Alcohol, some believe alcohol causes it. High calorie food intake surely is a very big cause. Mm-hmm. But Ayurveda sees this as one problem, that is derangement of your agni. When your metabolism is not correct, then you could be having so many faults at your metabolism. So to name a few, we have got these 4 or 5. So agni derangement is one definition which explains all of metabolic syndrome. If your metabolism, your agni is fine, then surely you in first place will not be getting this problem, or you can very well control this group of 4 problems.
So Agni is also called fire, right? So Agni in Ayurvedic terms is like a disturbance of your fire in the stomach. Is how would you, for a person who probably doesn't understand Agni, how would you describe it?
See, if we translate Agni, then you are correct. This can be labeled as fire, but fire we see in our kitchen or in the world, in environment. The fire is something different, but the process is the same. Agni or fire, they have got one thing to do, that is they transform. They bring the things to the next level. They transform. So the transforming mechanism in our body, that is metabolism, when we don't have an apt mechanism, when we don't have an apt metabolism, then we surely are going to produce something unhealthy, something toxic in the body, which would be leading to these problems. So agni surely, agni in the body or fire in the body is in liquid form. It is not a classical fire. It's a liquid. It is a combination of hormones and chemicals in the body.
Yeah. Okay, so let's talk about the diagnostic criteria if someone has a metabolic syndrome.
Yeah, then surely, because obesity is a very important factor. So central obesity, that is when the waist is 40 plus, 40-inch plus for male and 35 plus in female. Dyslipidemia, various forms of cholesterol can be irregular, including total cholesterol and triglycerides. Then blood pressure will be at least like 130 plus on the systolic, and 85 or 89 plus on the diastolic is the high blood pressure. And fasting plasma, when it is more than 110, because 70 to 110 mg percent, milligram percent or milligram deciliter is a normal range. If your fasting blood sugar is more than 110, or it's 6.1 micromole per liter, then a combination of these four uh, deranged blood parameters is the diagnostic criteria. Your BMI will be 30 plus normally,
So
a
someone
high
who's
body mass index.
yeah. So I'm just trying to understand from a user point of view. Let's say if anyone is obese, they should get themselves checked up for all the other tests as well, right? That's what you would recommend, because you want to. That's how would I know? How would someone know if they have metabolic syndrome? I mean, what is the first step? The diagnosis, like how do I diagnose that I have a metabolic
Yes,
syndrome?
yes, yes. See, one might be having one of these four pathologies, then one could be a bit luckier, like one could
Yeah.
be obese only, could not be having diabetes or blood pressure, or someone could be having two disorders, someone could be having three disorders. But when we clinically examine and someone is having all the four disorders, and this is very simple to judge, we can simply send the patient for blood sugar examination, blood sugar
Yeah.
testing, cholesterol testing. We can take the blood pressure and we can take the body weight. If all the four parameters are out of range, then we label that person to be a client of, a patient of metabolic syndrome. So very, very easy to diagnose.
Okay. Okay, let's talk about Ayurveda a little
Yeah.
bit.
Okay. Ayurveda, I believe, is the history of world medical system or world health system. This is the oldest healthcare system. So this is the history, and this is the future of medicine, because I have studied all the Western medicine in detail. We know everything about the Western medicine, and
Yeah.
seeing and comparing both, I'm very sure the principles Ayurveda delivers, the protocols Ayurveda proposes are unmatched, and they really hold the future. We have seen the healthcare system being with the Western medical doctors. This is leading to nowhere. The health is deteriorating. The cancers we were having at 70 and 80 years of age, now we are having at 30 and 40. Diabetes we were having after 50 years of age, now we are having at 30 or 20. So diseases are catching us fast. We are not leading a quality life. So Western medical care system somehow is not complete, is not fault free. When I compare this is Ayurveda, I believe Ayurveda is a much complete system. It proposes a balance among three doshas, Vata, Pitta, Kapha. You have to have a balanced Vata, Pitta, Kapha. What is health? If your Vata, Pitta, Kapha are balanced, you are healthy. If either of the three, either Vata or Pitta or Kapha, are out of balance, then you are unhealthy. Simple as that. And what is Ayurveda treatment? You have to restore the balance. How do we do that? We do that through four parameters. We correct the diet, we correct the lifestyle, we give some herbs to eat, and we detox through Panchkarma. There is no fifth entity. These four are the tools to balance Vata Pitta Kapha, and that is how we go ahead. That is what makes Ayurveda unique.
Okay, so let's talk about from an Ayurveda perspective, right? The metabolic syndrome. We talked a little bit about agni initially, but more in detail in this particular case.
Agni, as we have been talking, Agni is the total metabolism in the human body can be summed up as agni. Any metabolic process would be called agni. For example, you eat an apple. Apple would be going in, it would be processed, it would be broken down into simpler forms. Its the sugars would be converting to fructose, then glucose would be giving us energy. The iron from apple would be traveling to your red blood cells through bone marrow, and it would make you deliver better oxygen as hemoglobin. Vitamin C would be giving health to your vision and your skin, you know, and would be healing, would be leading to a healthier healing system, healthier clotting system. So apple we consumed was not compatible with the human body. It was simplified into smaller components what the body could use. So making something external, converting something external into something useful internally, or internalizing something external, you know,
Yeah.
converting something useless, apple was useless for bone or for eyesight or for skin. It had to be
Yeah.
broken down. That broken down or transformation is done through agni. So this is agni, and any derangement, any flaw at your metabolic um, processes is called a derangement of agni, which would be leading to production of a toxin called ama. Ama is a toxin which is exclusive with agni. Either agni would exist or ama would exist. You can have one only. If you have got 90% of agni, goes without saying that you have got 10% of ama. If you have got
I
60% of agni, then goes without saying you have got 40% of ama. Simple as that.
So that's a very interesting way that you talked about. It's basically 100%, 50% Agni, 50% Ama, or whatever the thing is, right? The sum has to be 100%. So how do we, it's very interesting concept, but now, how you talked about a little bit on the Western medicine earlier. Western medicine has a lot of diagnostic tools, which are very, I can get myself checked up. What is the tool that you can say I am 90% Agni and 10% Ama is my question. What
Okay.
test do I do?
Yeah, we have got, the beauty of Ayurveda is even you need not go anywhere. You need not go to any laboratory. If I ask you a few questions, I can tell you, Amita, right now, how much percentage of ama you have got right now. Talking a few
Just,
things to you. We
but
have
just
got
by
one
asking me
example.
questions, that's it.
Yeah,
Okay.
by asking the question, by looking at you, then
Mhm.
if we could be together, then I could check your pulse, I could examine you more physically anyway.
Mhm.
But still, there goes one shloka which says srotorodha balabransh gaurva nilamurtha. So if you have got channel obstruction, srotorodha balabransh, if you are feeling weakness, balab gaurav, if you are feeling heaviness, anil murtha, if you are not able to pass a flat study easily,
Mhm.
there are like 10 symptoms. If you have got one or two or 10 of them, that is the severity of ama you have got. Then I can tell how much ama or how many toxins you have got. That is how we diagnose if you have got ama or not.
I see. So it would be like, as an example, I'm not an Ayurveda doctor, as you know that. It might be like, say, I would come to you and I say, hey, Dr. Ish, I have bloating, or heaviness on the side, or having problems sleeping. So these are some of the symptoms, and that's how you will tell me, hey, you have certain ama buildup, right? That's the diagnosis, the flow. I'm thinking from a user point of view.
You are correct. You are perfectly correct. And then we have to see ama is at what level. You have got ama in your eyes or brain or skin or nails or kidney or liver. You know what severity of ama is this ama with vata or pitta or kapha, or ama with two of them or ama with three of them, because vata pitta kapha can be coupled with ama. That is
Yeah.
vata with ama, pitta with ama or without ama, and kapha with or without ama. That is how we go ahead, Anita.
Okay. Okay, so it's very complicated, but I think I understand. First you will figure out Vata Pitta Kapha if there is any imbalance. For the users, I want to simplify it, and then you would
Yes, yes.
talk about the symptoms, my symptoms, if I have bloating, flatulence, or any other issues, and then you try to figure out how much ama I have, and then you correlate
Yes.
my Vata Pitta in imbalance with the the ama build up, and then try to figure it out, saying together, now what do I do with Amita, right? That's what I figured this out, right? In a
You
very
are
simple
correct.
way. Yeah. Okay.
Yeah, you're correct, Amita. So actually, this is as simple as that. Once we discuss for some time, then surely I can simplify this for all.
Yeah.
As Einstein told, if you cannot simplify it, then you don't know it. So
Mhm.
I believe I know it and I can simplify it.
Sure. So, let's talk about your research now and the Ayurvedic treatment. So, I think a lot of people want to understand. You did a lot of research on metabolic syndrome. You used a lot of Ayurvedic medication, herbs, and diet and lifestyle, as you said earlier. So, let's talk a little bit about that.
Okay, when I pursued my PhD in Ayurveda in the years like 2003, 4, 5, and 6, in the years 2005 and 6 to be more specific, in the year 2005 and 6, I conducted the first clinical trial in Ayurveda upon metabolic syndrome. It was the first registered study
Mm-hmm.
upon metabolic syndrome with Ayurveda, and where my guide, my Guruji, he suggested me to take some herbs, which have got certain reputation in healing these systems or these diseases separately. So we combined Triphala, Haridra, Daru Haridra, Shankh Pushpi, Shilajit, Gugul. We Shankh Pushpi. We took these herbs and we delivered these to 50 patients with Dashmula Kvata, and the other 50 were given it with the Medohar Gugula. That is how we compared both the groups, and we found that these herbs given with Medohar Gugul were really effective, and we could see improved parameters on all the four counts: their body weight, blood pressure, cholesterol, and hypertension, blood sugar, all improved.
So
So
you said Medhu. I'm sorry. Could you repeat that? The one that you said.
yeah. There was one tablet what we call Medo Har Gugul, Medohargugul, Medo
Okay.
Har
So
Gugul.
Meduhar Google. So the most of the component of from Meduhar Google is coming from Google, because that's one of the. Is that what the ingredient is, or it is just a name and then there were different herbs in it?
Medo Har Gugul has got 10 herbs. One is Guglu, and
Okay.
the other 9 are Trifla, Trikatu, Trimad. So 9 herbs plus Guglu makes it Medo Har Guglu.
So this is widely available. This particular medication.
Very easily available. Yeah.
I see. So the Meduhar Gugulu was found to be more effective as far as the
Yes.
control or management of metabolic syndrome, as opposed to just giving individual herbs, right?
Yes. Exactly right. Yeah.
And how long did you conduct this clinical trial?
Yeah.
It was okay.
Yeah. The duration was 45 days,
Okay.
because we have to specify when we conduct a clinical trial, then we have to specify how long would we be observing the client, how long would we be giving the medicines. So the duration for my study was 45 days.
So in 45 days, let's say you conducted this, what was the results after 45 days? That's a very short amount of time for someone who has metabolic syndrome to start seeing a reversal of any symptom or any of the things that we just discussed earlier, right?
Yeah, see, Amita, the beauty is ama starts going away within 7 days. Ayurveda says if you have got ama and you start fasting, if you start under eating, then your ama would start going away within 7 days. So we were very positive with the conception of the idea, and 45 days was a handsome time. It was a time sufficient for a significant observation if my medicines were working or not. So 45 days was not a short time, and it was very simple. We took them individually. We noticed the body weight, we notice their blood sugar, their blood pressure, and their cholesterol level. So
Yeah.
all these four parameters can handsomely respond in 6 weeks. So 45 days was a like wonderful time, wonderful duration.
And then all the, you said 40, right? 40 people or 50 people, something like that
No,
initially.
100
100.
persons.
Oh, 100. So that's a pretty good number. So so they were able to either reduce their body weight, right, or lower down their blood pressure, or having all the things.
They were able to reduce their body weight and reduce their blood sugar and
Yeah.
reduce their blood pressure and like got a better cholesterol level.
So all four
All
things
the
had
four.
all four things had to go in the negative direction, in the right negative direction, in the sense, like, they had to reduce it to be able to be qualified as showing improvement.
Correct, yeah.
So, okay, so that's actually very impressive, because now people who are suffering, people who metabolic syndrome has become very, common, right? I think all over the world, but your research really proves the efficacy of Ayurveda, that it can, at least people can start with the management of the process of their condition in 45 days. 6 weeks is a very good time if you think about it.
Yeah.
Any questions from anyone? I see quite a few people in, I see people in Zoom. You are welcome to ask questions. I'm just trying to ask questions on your behalf to make it clear. And then now, so you did that for 45 days. Is there any way that you know that all those 100 people have been able to stay off, in the sense they haven't put on weight again, or their blood sugar is not high? All those, I mean, is there something, or that was like, have they been in touch, or was there any way that you could tell?
No, it was in the year 2005 and 6. So we were no longer connected. I
Yeah,
was bound to, I had to be in touch with them for the duration of 6 months
yeah,
or 9 months. During the study, I had to
yeah,
be in touch with them, record them. But once the study was over, and then I
yeah.
changed my place, I shifted from
Sure.
Jaipur to Punjab, and that is
Yeah.
how I lost contact with them. And
Okay.
I wish they could be doing fine. They could be aware enough to take care of their health
Yeah.
without my medicine.
Yeah. Yeah. But now, like in your practice, you are also a practitioner in addition to being an educator, right? You're a professor, and you're also a practitioner. So now since that, it's been almost 14 years, you must have seen a lot of clients who have come to you for metabolic syndrome, and you've used the same kind of principles and helped them along. That's what I'm right?
No
Okay.
more, because I did move on. That
I
was a
see.
study where
Okay.
I had to stick to one protocol which was decided by my teachers. So I had to
I see.
give those medicines only. But now, what I could add in these 14 years is I added Panchkarma
Okay, so at that
in
time,
my
Panchkarma was not included, only the herbs, yes.
Yeah, my study did not have Panchkarma, but
Okay,
now I tackle all the patients with diet modification, lifestyle modification,
yeah,
some herbs, and Panchkarma. The Panchkarma part was not there earlier, which is
got it.
very powerful.
That's right. And is there any particular, Panchkarma has 5 therapies. Is there any particular therapy that you think has been more useful than the other one, or you use all the Panchkarma therapies?
See, if the client is strong physically and mentally, then I would be giving Vaman and Vasti. Vaman and
Okay,
Vasti. That is,
yeah,
we would be inducing vomiting and giving
Yeah.
enema.
Yeah.
But if the client is having more symptoms and is not physically and mentally strong enough, then we would be giving all the 5 panchkarma, total detoxification, and that too not once. It
I
would be
see.
given once every year for at least 5 to 10 years.
Okay.
It's not a one shot management.
Correct. Yeah. Any questions from people who are in Zoom? You're welcome to ask questions. We are going to wrap up soon, but we have time for you to ask any questions, any comments, any feedback. You are welcome to ask Dr. Ish Sharma, who has been a clinician, who's done clinical trials. We try to bring you the best of the best from all over the world. So I wanted to interview Dr. Ish on his clinical trials for metabolic syndrome. You are welcome to ask questions. You can put it in the chat. That's perfectly fine. If there are no questions, I will keep asking questions and I will wrap up. So I understand now that you've added the panchkarma part of it and the herbs. Okay, so you talked a little bit about the Western medicine in the beginning. So there are a lot of, when I go into see the research, there are a lot of minerals. Okay, so I see a question. I don't want to be the one asking questions. Okay, I'm going to stop share and you can ask questions, without, being confidential. All right, so let's say someone is asking question for those losing a lot of weight. Does Ayurveda historically take the approach of protecting the brain with herbs while taking other herbs that help clear the toxins that are releasing? Question mark. I have heard of brain fog and other brain related symptoms, and my belief is that the toxins released penetrate the blood-brain barrier? It's a very good question. Excellent question.
See, brain has got a special kind of cell structure called astrocytes, which are star-shaped. There are star-shaped cells which form BBB or blood-brain barrier, and they won't be letting each and everything flow into brain, because brain is such a sensitive tissue. So surely there are a few things which cross blood-brain barrier, and many toxins, many ama toxins from Ayurveda, especially the vata kind of toxins, are too small, which can surely traverse the blood-brain barrier. And that is why we have to be very careful. The question is very wonderful. We have to be very careful. If we are dealing with ama toxins, we have to be protective for the brain tissue. We have to be more protective. And that is why all the vata symptoms are by and large psychological or neurological in origin. So we have to be careful with the brain tissues in vata kind of ama.
Okay. And any more follow-up on this question, or any comment? You're welcome to put it in the chat again. So careful meaning the herbs, the choice of herbs that you will give has to be very carefully chosen, right? That's what I'm thinking.
Yeah, see, whenever we treat, we can never go beyond these 4 things: diet, lifestyle, herbs, and panchkarma. So we have to play around with these 4 things only, and that is how we.
So, okay, so the comment is no. I was just wondering if this was a common protective measure or rarely considered. So she or he is
very commonly considered. That is what I'm telling. This is a kind of vata with ama, and this is very commonly considered. This is very important, so we cannot ignore this. Very commonly considered.
Yeah. Okay. So, I mean, any good Ayurvedic practitioner would consider this in a very common way, right? That's the way to put it in a simple way. Any other comment or any question from anyone else? So I was just going to bring out another thing on the use of minerals, herbal minerals, right? So there has been, if you go into a PubMed or some of the other research publications, there has been some kind of a negative things that has been written about minerals being used in Ayurvedic medicine causing toxicity, right? So can you talk a little bit about that? Because I think a lot of our viewers in US, they are a bit hesitant, including me, to be honest with you, that, I don't want having some metal going in my thing. And that's why they're not allowed actually in US.
This is such a wonderful question. And
Dr. Ish, you just froze there. Hello? Okay. Can you hear me?
Yeah, maybe can you put your question once again, Amita?
I was
I
talking
could not
about the minerals, the herbal, the herbal mineral compounds, right, in the medication. There has been a negative negative, if you go into the research, right? So, and that's one of the reasons in US, only herbal supplements are allowed, and Ayurveda is actually not recognized right now. So I want you to talk about, tell us a little bit about it.
See, there are four heavy metals. If we talk about minerals, then we have to zero upon four heavy metals: CALM, calm, cadmium, arsenic, lead, and mercury.
Yeah.
CALM, cadmium, arsenic, lead, and mercury. These are the four heavy metals. If these are consumed without purification, if these are consumed in heavy ppm, particle per million, if we consume a heavy doses, then these would be leading to liver and kidney toxicity. So surely we have to be very careful. In our practice, we never use these four heavy metals. Ayurveda has got a totally different take. These are so much purified, after repeated procedures to make them in a nanoparticle format, where these are so fine that these might not be leading to any damage. But not being controversial at all, we have practiced not to use these four heavy metals, but we are using other minerals like iron or calcium or magnesium, copper, mica. We are, because those are not heavy metals. Only these four are notorious. So we don't touch these four.
And then some of the herbs, and some of the herbs that are available in US, like Brahmi, Triphala, those are all plant-based. Right?
All
plant-based. Okay.
Those
Any
are
other
all
questions?
plant-based.
They are plant-based, and that's what is readily available here in US. If I wanted to buy Triphala and Brahmi or any of these herbs, I can all buy that.
Yeah, you only have to be careful with these four things. I repeat: cadmium, arsenic, lead, and mercury.
Mercury, yeah. But to an average user, we don't know. That's the thing. So that's why, so that's why I think in US, it's just not allowed, to sell any of the medication and any of the Ayurvedic medication that has any of the heavy metals.
It should not be allowed. That's a good, that is an approach for public safety. It has to go that way.
Correct. Because I'm an end user. I'm not an Ayurveda. I'm not a doctor. I'm not an Ayurveda doctor. So as an end user, I don't know. I'm not educated enough. So any other questions before we wrap up? Any other comment? Any other feedback? I just wanted to bring out what I think the users would want to hear. Any other comment? Any other feedback? We're going to wrap up the session then. Okay. All right. So thank you. Yeah.
My suggestion for someone, if someone is a patient with metabolic syndrome, you have to, if I give you one advice, then I won't be handing over some magic herb from my pocket, you take this from me. No, my one suggestion would be periodic fasting is the one word solution to metabolic syndrome. Never to overeat, never to eat without real hunger. You should go for periodic fasting and periodic detox. Then you will be safe.
Okay, intermittent fasting is
intermittent fasting.
Okay, and detox. Okay.
Detox. Periodic detox.
So detox. When you say detox, is panchkarma mainly, or just only through herbs? Also, you can do that.
It's panchkarma. There are many forms of do-it-yourself panchkarma also. We can train you at your, you can be at your place, and then we can devise some do-it-yourself panchkarma also. So you can do it yourself.
Oh, that's excellent. So let's talk after our session and see how we can offer that do it
Yeah,
yourself. Yeah.
yeah, we
Okay,
can
with
do
that,
that. Yeah.
great, great. Well, thank you so much, Dr. Ish, for being with us. I think this is a very
Welcome.
informational session. I hope our viewers feel the same way. Please help us share these sessions to help bring awareness of Ayurveda natural therapies to more people. With that, I'd like to wrap up the session. Thank you so much. Thank you for watching us. Bye-bye.